Hello, my name is Shkiyah Little. I am currently a junior at Spelman College, where I major in biology on the pre-med track, and I am from Greenville, North Carolina. So today I'll be presenting on my project titled Westside Health Collaborative, a review of wellness hubs. I worked under the mentorship of Dr. Latrice Rollins in the Department of Community Health and Preventative Medicine at Morehouse School of Medicine. Now on to background and community context. So in order to understand the need of Atlanta's West Side, I have listed a list of things that they currently under or experience as a community. They experience long-term health neglect in this underserved community, and this consists of certain social determinants of health, not limited to, but including limited transportation, poor housing conditions, and inadequate access to nutritious foods. These are structured measures of inequity, and they cause the community to experience disproportionate rates of chronic conditions such as heart disease, diabetes, maternal and child health concerns, along with mental health challenges. Now, moving on to the question that grounds this research, I have here, how can community informed health hubs improve chronic disease management and address social determinants of health while also reflecting residents' priorities? So the key word here is community informed. We didn't want to just impose our own beliefs on how a community can start moving towards better health, but we wanted to center their voices and experience and make sure that something sustainable and relevant to them was produced. So there were 6 key health priorities that grounded this research. We constantly were reshaping these priorities, taking note from the community. We had a series of community conversations where we had community members and partners, certain organizations that were in support of improving the health outcomes of this west side of Atlanta. So taking community feedback into consideration, we came up with these priorities. And one is to improve access to checkups and basic care. 2 is to support mothers and children. 3 is to expand on mental health and addiction services. 4 is to strengthen organizational collaboration. 5 is to support HIV care and increase PrEP access. And then 6 is to reduce heart disease and diabetes. So now we will move on to what is a health hub. We have 2 forms of a health hub. One is physical and one is network based. So in addition to receiving feedback from community members, I did perform some literature research, which I was looking at other communities who have tried to implement these forms or are looking to do so, and it is a fairly new implementation. So I found a few communities who have implemented it, but there isn't much results yet. The most substantial, the hub that had the most substantial data was in Michigan, but again, not much results there yet. It's fairly new. But during our conversations, we discussed physical hubs consisting of clinics, community centers, screening sites, health education spaces, and then network-based hubs would be consistent of trusted individuals, community organizations, faith-based institution, and informal support systems. So there would be select people who people would trust and know had access to certain information. So now we are currently moving into the analysis phase where we are using community feedback to identify actionable strategies, culturally grounded solution, and sustainable models. So ultimately, the goal is to advance health equity, not on researchers' own terms, but by grounding solutions in community voices and lived experiences. This project wishes to produce long-term change rather than temporary intervention.